have continued to tell the ladies how fun it is to be on this Dad Cypher and Fatherhood Chop-Up. So thank you for that, first of all.
My thing is this. If this group, if BFF were the Avengers, the Marvel Avengers, what character would you be and why?
Maybe Iron Man.
So Tony Stark's okay. Alright. He's one of my favorites. Okay.
And so our fearless leader, Dr. Brianna Lemon, she's down under the weather today, but she established this group last year in May with a vision of having sisterhood, scholarship, and solidarity. We are all coming to this work really to advance the issues of Black fathers and to advance practice in that space. When she talks about scholarship, she doesn't talk about just research. This is scholarship through practice, scholarship through research, as well as scholarship through policy. And so we've kind of, I think, been picked one by one as we've seen, different things that she's doing. Or for some of us, like for me, I heard about it and then I told her about other people that I knew who were doing fatherhood work. And she reached out and kind of vetted them and invited them in. But like you said, we are all across the country. We want this to be a global network. That's why the young lady is sitting on the globe. We want this to be something that's international, not just here in the United States, and women coming from all different disciplines to do this work unapologetically. And so we are from different, like I said, different states, different disciplines, different interests, but all around advancing Black fathers and their families. So.
What is the plan that you have in place that's going to get brothers out of the barbershop and into the therapy chair? Because I'm going to tell you, I go to the shop all the time. Sometimes you get some good advice, but sometimes you get some advice that's not so good.
Bro, wake up one morning with some money, the subject to go crazy,
When it comes to fathers, so I'm like, some of y'all brothers probably need some more, get some credentials other than having the alcohol, put on the back of your head.
What is that, Hennessy?
We need to know, we need some more credentialed people to help us out. So with that being so, what is the plan that you have in place that will help us as men transition into taking mental health seriously, where we don't have that stigma behind it?
Yeah, and honestly, it doesn't have to be mutually exclusive, right? I mean, barbershops and therapy can work together, either or, whatever works for you. I do hear your point, though, that some of the advice that's given, we don't necessarily recommend that barbers give advice. I do know that there are a lot of different initiatives that have been going on for years. That has been a tested model of, barbershop mental health therapies, especially for Black fathers, just to get them to talk, just to get barbers to understand the signs and symptoms of mental or emotional distress, so that they can refer those brothers to speak with the therapist and encourage them not to be their therapist, but to, let them know that they're there to listen and to get them to share, because that's a lot of what happens. There are different issues and men don't know who to talk to about things, or they don't want to open up. But we understand that barbershops are safe spaces for a lot of Black men, and like you said, they do tend to share. So we want to capitalize on that, right? And so there are projects like the Confess Project that's going around the country, working with barbers to train them on recognizing the signs and symptoms of emotional and mental distress, and being able to refer those fathers as necessary, right, to get the help that they need. But we also have to think about therapy as something more, just like if we were going to do our physical checkups and things like that, we have to look at our physical and mental health in the same light. We can't continue to stigmatize mental health. We have to go get our checkup from the neck up, as my mentor says a lot of times, just like you would everywhere else, So we have to start to normalize going to see a therapist if there is an issue that we're stuck on and we don't necessarily have friends and family that we can confide in and get that unbiased good advice. It's perfectly fine to go to a therapist, and we just have to start to normalize that. And some of those ways that you said is talking and working with those barbershops or other common places, churches, to train them on the ways in which you can recognize symptoms and be able to refer our brothers to get their checkup.
Yeah, you know what? And I would say this for myself: depression. I didn't realize depression ran in my family for 3 generations, maybe even more. That's 3 generations that I know of this whole idea of depression, but no one talked about it. And it wasn't until, like I stated earlier, that I saw like the HBO fictional show called In Treatment, and I saw Blair Underwood as the first black male that I really saw going through psychoanalysis therapy and dealing with trauma. I would definitely say I still have a therapist today that is helping me to kind of deal with the trauma of growing up not only in a kind of toxic environment and that sort of thing, but even for some of my behaviors and how I pass some of those traumas on to my children. And how do I reconcile those behaviors and that sort of thing? So, anything, if we can't, the barbershop, if they can be an agent to get these brothers there, I would say let's continue on with that, and so that's awesome advice. And like I said, we have to, going through the barbershop may be a way to lessen that stigma if more and more brothers are becoming open about, sharing our emotions and that sort of thing. So that's awesome.
And in terms of what we're doing with the cycle of inclusion, Wakina and I are working on an exciting project, our Fathers Matter initiative, mobilizing fatherhood in Metro Atlanta. We are looking to really touch each domain, each sector of services, of health, business, and letting everyone know that we should be promoting and supporting father involvement in Metro Atlanta. I describe it as a cycle of inclusion because there's a number of different spaces, whether it's education, practice, research, or policy. All of these different areas have an impact on the lives of fathers and families. But for whatever reason, we haven't really focused on them as much as we should. Even though we have programs that say, we're here for the best interest of the child. We're trying to work with parents. We're working with families, but for whatever reason, fathers are not a central focus. And so our goal and vision is to really develop a system, develop services that include fathers just as much as they include mothers and babies. And so this is the perfect place to do it. Atlanta is the cornerstone of the civil rights movement. We have 6 HBCUs here that are all committed to equity and social justice. We have some of the top public health programs and systems, the Centers for Disease Control and Prevention. We have what we need here in Atlanta to create a model system and program for fathers and their families. So we're excited and just ready to do the work. Aging African American Fathers, Strategies and Lessons Learned. I serve as the editor of that book. A couple of chapters I authored, but it is also authored by another group of wonderful Black women who are practitioners in the field, and they share their expertise on how they engaged and worked with Black fathers in a number of different spaces. You can find that book at latricerollins.com or any of your typical booksellers, or Amazon, Barnes & Noble, that type of thing. I also want to share that we are going to have a Black Fathers in Depression webinar through the Black Female Fatherhood Scholars Network on May 26th at 6 p.m. You'll be able to register for that event through Eventbrite, and also you'll be able to see the flyer and all the information about it on our Twitter as well as Facebook. So look out for that on May 26th, where we'll be talking with a number of panelists who are researchers as well as clinicians, as well as fathers who have had to deal with depression. We want to lift that up in honor of Mental Health Awareness Month this month.
And I just want to say this for you dads that watch the show and say, I don't deal with depression and that sort of thing. If you're drinking Henny in the morning, you are dealing with depression, my man. So